Hello everyone. Today I'll be discussing a retrospective study that I participated in entitled Characteristics, Therapeutic Approaches, and Outcomes of Patients Older than 80 Years Old with Metastatic Colorectal Cancer Compared with Younger Patients. I worked with Dr. Yannis Voutsidakis for this project. I have nothing to disclose. Colorectal cancer is one of the most common malignancies globally, and its incidence rises significantly with age. Among individuals over the age of 80, the disease is more prevalent, but this group remains underrepresented in clinical trials and often receives less aggressive treatment. This can lead to inequalities in care, often driven more by age-based assumptions than individualized assessment. This study aimed to examine and compare the clinical characteristics, treatments, and outcomes of patients aged 80 and older with those aged 65 to 75 years old who were diagnosed with metastatic colorectal cancer. We conducted a retrospective chart review at a single Canadian cancer center from 2017 to 2023, involving 32 patients aged 80 years old or older and 41 patients aged 65 to 75. We analyzed the clinical features, lab results, treatment patterns, and overall survival outcomes of these patients. Statistical tests were then used to assess the differences, with p-values less than 0.05 considered significant. Some of our key findings included identifying tumor characteristics between the two populations. So we found that right-sided colon cancers were significantly more frequent in the older age group, with 71.5% of patients aged 80 plus versus 34.1% of younger patients with a right-sided colon cancer. Stage at initial diagnosis differed significantly as well, with 59.5% of younger patients presenting with a de novo stage 4 disease versus only 22.2% of older patients presenting this way. We also found that elevated carcinoembryonic antigen levels were higher typically in younger patients versus older populations. In terms of treatment in Table 2, we found that neoadjuvant chemotherapy for rectal and rectal sigmoid tumors was received by 71.4% of younger patients versus only 16.7% of older patients. Adjuvant chemotherapy for prior stage 2 disease was given to 100% of younger patients versus only 20% of our older patients. Palliative chemotherapy usage showed a non-significant trend between the two groups, with 53.7% of younger patients versus 34.4% of older patients receiving this care. So, while younger patients were more likely to receive systemic therapy, the difference was not statistically significant. To summarize, older patients more commonly presented with right-sided tumors. They often had lower rates of de novo metastatic presentation, and less frequently they were using chemotherapy as a method of treatment, especially in the adjuvant and neoadjuvant settings. Despite this, we did find that there was no statistically significant difference in overall or progression-free survival between these two groups. So these findings suggest that chronological age alone should not dictate treatment decisions in metastatic colorectal cancer. But with careful selection based on performance status, organ function, and patient goals, older adults can safely receive and benefit from active therapy. We recommend a personalized, age-inclusive approach to treating patients with colorectal cancer above the age of 80 in order to optimize their care. Thank you for your time. I'd be happy to answer any questions.